Today I stand on the Senate floor and continue a very important discussion that I began with all of my Republican classmates in the Senate several weeks ago, and it's about the need for dramatic, bold health care reform in this country. We adopted this as a class project, if you will, and again I want to thank my colleagues, Senators Thune and Burr, DeMint, Martinez, Isaacson, and Coburn for their hard work on this important debate, on this important discussion. And again, the idea is very simple: to put forward our conservative free market principles and what vision that leads to in terms of necessary, bold, transformative health care reform, and also to provide a clear contrast between that vision and the alternative, which is clearly, in our mind, a big government solution, a one-size-fits-all solution that has the government role in health care grow and grow, and private individual choice lessen and lessen. In the first week of this discussion on the Senate floor, I rose and laid out our broad principles and where we wanted this discussion to lead to. Again, as I said that week, I believe there is great consensus in America, almost universal consensus, that our health care delivery system is badly, badly broken and that major reform needs to take place. But of course, having said that, the hard part is figuring out what that change is, how it can work best for the American people. And as I said in those introductory comments, I believe the broad choices are clear. Our conservative free market vision is to empower the individual, to maximize choice, to help everyone get good private insurance that's accessible and affordable, to use taxpayer dollars where appropriate to help the truly poor afford that sort of good private insurance that stresses preventative care and other measures that will bring down health care costs. But that's a very different vision than one based on government first and foremost, based on government programs, one size fits all, growing those programs, and in the process lessening individual choice and responsibility, lessening the sanctity of the individual doctor-patient relationship. The second week of our discussion, our colleague John Thune came to the floor, and he elaborated on a very important component of this message, which is that we want to stress private health plans, choice of private health plans, that as the predominant factor in American health care versus government programs, one size fits all, pushing people more and more in that direction and increasing the dominance of government in this very major sector of our economy. And following up on that, I come to the Senate floor this week to talk about a closely related principle and closely related theme, and that is, again, opting for individual choice and incentives versus forced enrollment, forced action put upon citizens by government. Again, this is a crucial element of our vision of the dramatic, bold health care reform we need. We believe firmly, we believe strongly that individuals are capable of choosing their own health insurance plan, and that we must continue to focus on individuals and empower individuals with choices and with incentives, not force individuals in a certain direction. So we're opposed to forcing people to enroll in certain plans rather than providing incentives for individuals to make rational choices that fit their own circumstances. Congress should be pushing reform, again, that creates those incentives for individuals, for employers, for insurance companies, for states to come up with innovative solutions. We shouldn't be forcing mandates down people's throats, forcing them to enroll in any certain big government or other program. And the way we can most effectively maximize this choice and empower the individual is probably through the tax code, to create options for families and individuals through a tax code that helps those families buy insurance, that creates those incentives, that makes sure that it's accessible and affordable to everyone. Now, as I suggest, Madam President, I have some pretty fundamental philosophical objections to mandating action on people. But in addition to that, I have some very practical concerns. If we look at other jurisdictions, states, other countries that force these mandates on people, we find that they really don't work in the end. I'll give you a few examples. Hawaii, obviously a state in the United States, has a mandate that all employers must provide their workers with health insurance. Well, you may think that's a magic wand that just automatically solves the problem, but it doesn't. First of all, unfortunately, it creates a barrier in many instances to creating jobs, increasing employment, growing business. So that's a problem. But even beyond that, it doesn't insure all workers. In fact, in Hawaii, 10% of workers, not unemployed people, not non-workers, 10% of workers do not have health insurance. So there's a very practical issue of simply throwing out an edict, a mandate from the government doesn't accomplish the goal. Another example is Canada. Canada requires everyone to be covered. But that, again, creates significant challenges in actually making that happen and actually enforcing that rule. For instance, in the province of British Columbia alone, more than 40,000 people somehow slip through the cracks, slip through that mandate. It isn't a magic wand. It doesn't get done. So we believe that there is a better way, and that is to maximize choice, empower the individual, create incentives. And that will get a very great number of people enrolled with access and affordability to health care. We believe as part of that, that existing government programs can be improved and modernized and made more efficient, and that's important. But we're opposed to attempts that often come up in this body and the other body in Congress that try to significantly expand. America agrees that the American health care delivery system is badly broken, that we're in desperate need of not just tinkering around the edges, but bold, dramatic reform. And so we want to come forward and lay out those conservative and market-based principles that we believe are the right type of change, the type of reform Americans want. Reform that empowers the individual, that respects that individual doctor-patient relationship, that maximizes choice and creates incentives, not the wrong choice that grows big government, that lessens choice, that increases mandates, that pushes individuals in a certain direction rather than allowing them to understand what best meets their needs. Next week, Madam President, we'll continue the discussion and the debate as another of my Republican Senate classmates takes to the floor to take another issue in this important discussion, and I look forward to listening to that and participating in that discussion. With that, Madam President, I yield back the floor.